Hey guys, it's Lockie and Georgia from VSRC here for our final little video on joint health and things to do to support that. So one of the big myths we get as allied health professionals is, can we train when we're in pain? A lot of the time people stop, which can actually be counterproductive. So we have different rules for different parts of the body. So if we look at the shoulder, obviously if it's a bit of pain, typically we tend to say, hey, let's not load it, let's give it a chance to settle. On the other side of things, we come to our lower body or our spine, and from the research does as well as clinically what we see, they tend to do better when we load them. So one of the things we're going to go through right now with Georgia is two variations of a squat. One's going to load your knees and hips, and the other's going to load your lower back more, and these implications as to why we do them. So we know with knees in particular, as we age or get into those osteoarthritic conditions, that the cartilage does thin out a bit, which can predispose you to making that worse. We know if we do load it safely and smartly, we can actually at least delay the progression of these conditions as well as mitigate a healthy quality of life. So what we're going to get Georgia to do is go through a normal squat, which typically this loads your knees and hips and ankles and minimizes the load on through the back, and then we'll go through the next progression or regression. So can I get you to do a normal squat for me, George? So as we can see Georgia here, she's just squatting down. There's nice load through those knees and those hips, which is what we want to do for someone with that osteoarthritis or that knee. And here is doing it side on. So weight is even and she's hitting a great depth. So that's to load the knees and hips. Now what we're going to do is, if you have a sore knee or hip, we're going to show you how to load that more so it becomes a bit more in through the top part of those hips and back. So Georgia, we're going to use the box here, and then what I'm going to do is sink your hips back for me. Good, touch and come up. So this squat here is a box squat. It has a lot less motion at the knee, so it does load our glutes and our lower back a lot more. So there's two strategies to mitigate against pain with exercise, and why we encourage exercising under pain and just finding the right movement for you.